2020 was a very difficult time. We had some internal changes. COVID had hit. This program started right about that time and really, I think, helped us focus on what was important.
Our patients in our community are getting the same quality of care and access to care that patients who live in bigger areas have.
Washington County, it's a small community, about 60 miles south of St. Louis. A nice rural setting to where everybody knows everybody, and if someone needs help, everybody reaches out.
That's kind of what Great Minds Health Center brings to the table for our community, is that access to quality care, to collaborating physicians, and we're able to provide that no matter the income of that patient or the ability to pay. Delta did come in and provide us with the funding that we needed to enhance our telehealth capabilities. So we were able to purchase a more strategic kit that would provide the provider with more hands-on experience. So we were able to expand that quality of care and the quality of that assessment that the provider was able to do with the patient, even though the patient wasn't home. Then we also utilize that in our school-based programs as well.
It's allowed them to prioritize their mental health. Without telehealth and without me being able to be in the schools, there would be so many kids who would never get to come to the counselor because their parents are either working or they don't have transportation to take them out of school to bring them to see me. And so it's just those services that we can provide. It's helping a whole generation, multiple generations of people who now have access to that care that they never did.
They coordinate with a program we have with community paramedics, go into the patients' homes, address whatever needs they have. We never had that community connection prior to this program. They came to us. Now we go to them. If you go to a patient's home and do a telehealth encounter, they don't go to the ED. It saves the system money. Matter of fact, the Mobile Integrated Health Network program that began in conjunction with this program, saved over $1 million in the first year of diverted ED care by doing community-based interventions.
I'm able to go out there and connect them with the doctor. One of the features is with the stethoscope, whatever I hear, the doctor can hear. The ping camera, whatever I see, the doctor can see. Being out there in this case helps be an extension of the doctor's hand.
Well, people that's disabled that can't do what we used to do. I can't do a lot of stuff that I used to do. It's just a wonderful thing to have him come in, and I'm comfortable with him. And I can ask all the questions that I've built up within that month, and it helps me to know what's going on with myself. I get to talk to my doctor, which is a blessing too. I love her to death. I don't even have to go in or nothing, she's right there, and I look forward to seeing her.
What I liked about the consultants from the Delta program was how it helped us engage with our community partners.
We have a much greater presence in the community now. I think a lot of healthcare entities tend to partner with their own. So it was nice that they had us draw out folks from like law enforcement and education and the faith-based community and bring all those folks together. And we got greater input because we made it more all-inclusive.
This program brought the entire community together, the Sheriff's Department, Police Department. It was all about working together, linking resources.
Having gone through that process and understood people's needs and kind of what they wanted to prioritize as community needs, it really helped us moving forward.
The Delta program was definitely helpful to Great Minds because they provided an expert opinion and strategic planning for us.
We probably wouldn't have the strategic plan we have now if it wasn't for the action steps through this program. I'm very grateful.
You can tell by our budget. Our budget's grown by millions of dollars, so that means we have more practitioners, we have more staff, we have more services. The Rural Center will walk you through the skills that you need. They will help you convene the community meetings. They will help you convene the partners. They will help you with, grant funding. They will help you with any number of other things that are specific to, things that might challenge your hospital or your center. The collaboration's been incredible.